Hello, my dear friends. I know that for many of us, navigating the world of healthcare can feel like trying to read a map in a foreign language. Especially when it comes to Medicare, the rules and options can seem overwhelming. But you've worked hard your whole life, and you deserve to enjoy your golden years with peace of mind, not stress. That's why today, we're going to walk through this together, step by step, and turn that confusion into confidence. First things first, let's figure out where you stand right now. Do you know what kind of Medicare plan you have? Is it original Medicare, maybe with a separate Part D plan for prescriptions? Or are you enrolled in a Medicare Advantage plan, sometimes called Part C? Knowing this is your starting point. It's like knowing your address before you use a GPS. Take a look at your insurance card and any mail you've received from Medicare or your plan provider. It will tell you what you have. Also, check your recent statements. How much are you paying each month in premiums? What about deductibles or co-pays when you visit the doctor? Just getting a clear picture of your current situation is a huge first step. Now let's talk about something that affects so many of us, the cost of prescription drugs. Have you ever felt that pinch at the pharmacy counter? The benefit of regularly reviewing your medications is huge. It could save you a lot of money. Under the Inflation Reduction Act, Medicare can now negotiate prices for certain high-cost drugs. For 2024, the list of the first 10 drugs includes common medications like Eliquis for blood clots, Jardiance for diabetes, and Xarelto. You can find this full list on the official Medicare.gov website. So here's your action step. Make a list of all the medications you take. Then check if any of them are on that negotiation list. You can also use the Medicare Plan Finder tool on Medicare.gov to see how your current plan covers your specific prescriptions. A potential side effect of not doing this is that you might be overpaying, or worse, skipping doses because of cost, which can be very risky for your health. If you find your drug costs are high, what's the solution? Talk to your doctor. They are your best ally. Ask them if there are lower cost alternatives like generic versions that would work just as well for you. For instance, a 2021 study in the Journal of the American Medical Association found that using generics could save patients billions of dollars. Don't be shy about having this conversation. Your doctor wants what's best for you, and that includes your financial well-being. As we look ahead, it's important to remember that plans can change every year. What was a great plan for you last year might not be the best fit next year. So, when the open enrollment period comes around this fall, it's your chance to play detective and compare new plans for the upcoming year. The big question is, what should you be looking for? The benefit is finding a plan that saves you money and gives you better care. But there can be risks if you only look at the monthly premium. A plan with a $0 premium might look tempting, but it could have high co-pays every time you see a specialist or a high deductible you have to meet before coverage kicks in. That's a side effect that can lead to surprise bills. So here's your solution. Look at the whole picture. When you compare plans, pay close attention to the premium, the deductible, and the co-pays for doctor visits and prescriptions. Also, and this is crucial, check the provider network. Is your favorite doctor in the network? What about the hospital you prefer? If you travel, check the coverage area. Some plans only cover you in a specific region. Finally, look at the prior authorization requirements. Some plans require you to get approval before they'll cover certain procedures or medications. This can cause delays in your care. A friend of mine, David, switched to a plan with a low premium, only to find his cardiologist was out of network. He had to start all over with a new doctor, which was incredibly stressful. Don't let that happen to you. Take your time and compare everything. Now let's talk about something that's not glamorous, but is absolutely essential. Paperwork. I know, nobody likes organizing files, but have you ever had a billing error or a claim denied? It's frustrating and scary. The benefit of keeping your records organized is that you become your own best advocate. You have the proof you need right at your fingertips. The risk of not doing this, you could end up paying for a service that should have been covered, or spending hours on the phone trying to sort out a mistake without any documentation to back you up. It's a headache you just don't need. So the solution is simple. Get a folder or a small filing box. In it, keep copies of your Medicare card, a summary of your plan's benefits, and a list of all your doctors and pharmacies with their contact information. Every time you get an explanation of benefits in the mail, review it. Does it match the services you received? If not, you have your records ready to dispute the error. Keeping a simple log of your doctor visits and prescriptions can also be incredibly helpful. Think of it as your personal health library. It empowers you and protects you. Next, I want to touch on something that we often put on the back burner: preventive care. Have you ever thought, I feel fine, so I don't need to see the doctor? The tremendous benefit of preventive care is that it catches problems early, when they are much easier and cheaper to treat. Prevention is truly the best medicine. For instance, Medicare covers a wide range of preventive services, many at no cost to you. This includes flu shots, pneumonia vaccines, and screenings for things like cancer, diabetes, and heart disease. The risk of skipping these is clear. A minor issue can become a major health crisis. A small treatable problem could go unnoticed until it requires expensive and invasive treatment. According to the Centers for Disease Control and Prevention, CDC, vaccines are one of the most effective tools we have to prevent serious illness, especially as we get older. So what's the solution? At your next doctor's appointment, ask, what preventive screenings and vaccines are recommended for someone my age and health status, and are they covered by my Medicare plan? Your doctor can give you a personalized checklist. Schedule those appointments. It's a small investment of your time that pays huge dividends for your long-term health and your wallet. Don't wait for a problem to appear. Be proactive and take charge of your health. Finally, the world of Medicare is always changing. New rules are made, coverage options shift, and costs can go up or down. Have you ever been hit with a surprise bill or found out a rule changed that you didn't know about? It feels unfair, doesn't it? The benefit of staying informed is that you can stay one step ahead. You can anticipate changes, plan for them, and make smart decisions for your health and budget. The risk of staying in the dark is that you might miss out on new benefits or get stuck with unexpected costs. You might not realize you're eligible for a program that could save you money, or you might be blindsided by a change in your plan's coverage. The solution is to find reliable sources of information. The official Medicare website, medicare.gov, is your #1 resource. They have tools, articles, and up-to-date information. You can also look to non-profit organizations like the AARP or your State Health Insurance Assistance Program, known as SHIP. These programs offer free, unbiased counseling to help you understand your options. Just spending a little time each month catching up on the news can make a world of difference. You've navigated so many of life's challenges to get here. You are strong, you are wise, and you are more than capable of handling this. By taking these small, practical steps, you are not just managing your health care, you are taking control of your future and ensuring you can enjoy every precious moment. Thank you so much for spending this time with me today. I hope this was helpful and made things a little bit clearer. If you found value in our chat, please consider subscribing to the channel for more tips to help you live your healthiest, happiest life. Take care, and we'll talk again soon.